Today we're breaking down America's healthcare crisis, why it's broken, who profits, who suffers, and how we're going to heal it. Before we move forward, comment below, share your story, challenge mine. We're building a community to get things done in the right direction. What is this crisis we're in the midst of? It's not just about high premiums. It's about bankruptcies over broken arms. It's rationing insulin, people stretching their supply to make it last because they can't afford to get the normal doses. Skipping cancer screenings. It's about 1 in 4 Americans with medical debt. It's a system where profit quite simply outweighs people. About 60% of adults in America have at least one chronic disease, and 40% of adults have at least 2 chronic diseases. These chronic diseases, cancer, heart disease, diabetes, arthritis, Alzheimer's disease, obesity, they're the leading cause of death and disability in America. This drives healthcare costs up. Who's affected? Uninsured gig workers, senior citizens who have to juggle meals or meds, young adults aging out of their parents' plans, rural families miles from an ER, and disabled folks caught in the red tape. In fact, let me give you an example of this. A woman with a spinal injury gets her home care costs slashed from 40 hours a week to 8 hours a week. She can't bathe, dress, or use the restroom without help. So what's the alternative? She gets institutionalized, even though it costs twice as much as home care. So why do we do this? Under our current system, Medicaid has to cover nursing homes, but home care is optional. But it's short-sighted, as are many things in our society. We like to see instant results instead of playing the long game. Initially, it's easier to fund the facility, but in the long term, you're spending more for less. And why does this keep getting worse? Premiums are up, deductibles are up, yet wages are stagnant. And we've got medical monopolies. That's big hospitals, insurance, pharmacy benefit managers. They're merging. This is less competition, which means they control the prices, which means higher bills for you and me. And don't get me started how hard it is to talk to someone competent when you're inquiring about your insurance plan. Over the phone, one person transfers you to the next, and they transfer you to someone else. And there's always a gray area about what your insurance covers and what it doesn't cover. This results in ambulance bills being like $2,000 because it wasn't in network. When you're about to get a procedure done, try finding the right person to talk to who's going to actually tell you what it's going to cost you out of pocket. Usually you never know until you get the bill, and then your head explodes. Let's take a step back in history to find out how America's healthcare system got to how it is today. Maybe we can learn from it and come up with solutions to improve what we have. In the 1940s, employer-based insurance became the default. During World War II, employers cannot afford to raise wages of their employees, so instead, they offered them health insurance. In the 1960s, Medicare and Medicaid were launched. These programs were government funded, and they helped seniors and low-income Americans. But there was still a great majority of the Americans who weren't covered. In the 1980s, for-profit hospitals expand. Healthcare becomes big business. There's more focus on profits, billing, and marketing, not just patient care. There's pros, of course. This introduces business efficiencies and innovation into hospital management. Business attracts private investment. This helped modernize facilities and equipment. And in many regions, patients have more choice. But here are the cons. This shifted the focus from patient care to profit margins. Medical billing becomes more complex, and there's aggressive pricing strategies. Remember, it's a business. And when you're in a business to make money, you're going to cut costs to build your profit. Maybe you get rid of staff. Maybe there's shorter patient stays. And you can bet there's going to be an attempt to upsell procedures to the patient, when in reality, maybe that procedure isn't even necessary. Perhaps the problem could be solved by better nutrition, exercise, lifestyle. In the 2000s, that's when we had the mergers, the big hospitals, the insurers, the pharmacy benefits managers. This resulted in less competition, higher prices. The ACA, the Affordable Care Act, helped millions get insured, but it's complicated and expensive. And today we've got the lobbyists to contend with. 700 lobbyists for every one member of Congress in healthcare, which means we've got big companies spending huge amounts of money to influence laws. The result? Real reform is getting blocked by these big companies who have their own self-interest in mind rather than the good of the public. Maybe you're like me and you've gotten confused with the concept of deregulation when it's associated with the healthcare system. I always connected deregulation with more competition, free market. That means the prices get lower, and this inspires innovation. This is true in a lot of normal markets, like the airlines, cell phones, groceries. They're competing, they're lowering their prices, improving their products, and we're benefiting. But with the healthcare system, it's not a normal market. As patients, when we have an emergency, we're bleeding in the ER, we're not going to be shopping prices. We're going to take what we get. Providers know that, and they price accordingly. As I alluded to earlier, most people can't even get the price until after the procedure. That makes competition ineffective. Hospitals charge wildly different prices depending on what insurance you have. So with deregulation, you don't have the price caps. And when you don't know the actual price, they can skyrocket. You go into the hospital for a Tylenol and a Band-Aid, you come out with a bill for $5,000. So the bottom line, deregulation without price caps equals chaos. Competition without guardrails creates confusing bills, inconsistent pricing, and inflated costs, not consumer savings. Let's go outside of the US for a case study. Taiwan. In 1995, they went to a single-payer system. Everyone's covered across the board. Wealthy, the poor, employed, unemployed. What are the results? Taiwan's got one of the lowest healthcare costs in the world. Electronic health records for all citizens. They got the streamlined billing. Less paperwork, less waste. And from what I hear, there's a high satisfaction rates among the patients and the providers. Taiwan built this hybrid model by basing it on other systems across the world. Germany, Canada, America, and this is what they came up with. Although Taiwan's system is considered the most efficient in the world, it does have its problems. Nothing's perfect. There's the financial strain. The system is so efficient and popular, it's overused. Costs are actually rising faster than revenue, so it's not sustainable. Reforms will have to be made on a continuous basis. Doctors aren't paid a lot. That's a big issue. And they're seeing as much as 50 patients per day. You're going to get diminishing results if that's the case on a regular basis. And as is the case in many countries, Taiwan is facing an ever-growing elderly population. This puts strain on the whole system. There's the ongoing debate. Many Americans are pushing for universal health care, like they do in Germany, Canada, Australia. But there's pros and cons for those systems as well. Let's start with the pros. You're going to have lower costs, obviously, fewer bankruptcies, and the system is simpler. The cons? Longer wait times for non-urgent care, higher taxes, and less luxury-level choice. Now let's hear from two American historical figures, each with opposing views on healthcare. First, there was Franklin D. Roosevelt. He felt that healthcare was a human right. He believed that government should guarantee healthcare to anyone regardless of income or job. FDR was our 32nd president, the only president to serve 4 terms from 1933 to 1945. The right to adequate medical care and the opportunity to achieve and enjoy good health. That is not a privilege. It is a sacred duty of a civilized nation. This stance is actually the backbone of Medicare, Medicaid, and is a call for universal health coverage. Barry Goldwater was the presidential nominee for the Republican Party in 1964. He wrote the book, The Conscious Conservative. Barry Goldwater saw healthcare as a market commodity. He felt personal responsibility and private innovation were keys to efficiency and believed that the government should be hands-off when it comes to healthcare. The government must never be allowed to set the price, the quality, or the availability of medical service. That is the surest path to socialized medicine. And once you go down that road, it's damn hard to turn back. Now it's time to turn to Greek mythology for a cautionary tale. Asclepius was the son of Apollo and a mortal woman. He was trained by the centaur Chiron and became such a gifted healer he could even bring back the dead to life. But there's when things went wrong. The almighty Zeus saw this as a threat to the natural order. If people could be resurrected, what would happen to the balance of life and death? What would happen to Hades' underworld? What would happen to the gods' control? So Zeus strikes down Asclepius with a thunderbolt. Not because healing was wrong, but because healing too well challenged the system. So why does this myth connect to America's modern-day healthcare system? We actually have the tools to heal better, faster, and more affordable than ever before. But here's the catch. The system often punishes innovations that threaten the powerful interests. Pharmaceutical monopolies, insurance giants, lobbyists. Like Zeus, our modern gods are less afraid of death than they are of losing control. It's time to laugh with our two comedians. You ready for the showdown?
You want a $10 hospital visit with government cheese? Go ahead and move to Cuba. I hear the doctors there do the open heart surgeries with soup spoons and crazy glue. America has miracle drugs for everything. Depression, cholesterol, even weird foot fungus your cousin get in Florida. But to afford it, you have to sell a kidney. And then you need the drug not having kidney. You think your HMO takes forever? Try getting surgery from a guy who moonlights as a cab driver and barters stitches for cigarettes. My good buddy have panic attack. They bill him $4,200. For what? The hospital gave him Xanax in a hug. Next time, call me. I do it for $5. Makes me sick to my stomach when I hear lazy Americans complaining about our great system. You get a $40,000 hospital bill in America, you know what that means? You live, son. That's right. It ain't a bill. It's a receipt for your freedom. Meanwhile, over in Europe, you get socialized medicine and a 3-month wait list to get your rash checked. Profit-driven is not the good. You come in sicker, they don't check your pulse. They check your credit score. Okay? I say, Doc, I have chest pain. He say, ooh, okay, let's run your insurance first. I say, is this hospital or car dealership? In Korea, hospitals say, where does it hurt? In America, they say, who's your provider? What's your deductible? And can you co-sign for your kidney? Government healthcare? That's like DMV with a scalpel. Are you really going to trust the same folks who handed out $200 billion in COVID relief checks? The companies created by some kid in his mom's basement? Hell, I'll take my chances with private clinics, a credit card, and good old American grit. In America, you say work hard, chase a dream, but it feels more like work 3 jobs, chase Xanax. In Korea, we call it Squid Game. In America, you call it LinkedIn Premium. Healthcare ain't supposed to be easy. It's supposed to be earned. Like my Ford F-150, my concealed carry permit, and my 3rd marriage. It is for real, okay? America is like game show. You spin a big capitalist wheel. Either you become one of 1%, or you spend your life making lattes, driving Ubers, or giving foot rubs to guy who did. Everyone's always complaining that America spends more than any other country on healthcare. That's right, because we spend more on everything. Football, Silicon Valley tech, Hollywood blockbusters, supersize me's, big pharma R&D. Other countries get free checkups. We get robotic liver transplants at 3 a.m. with a drive-through IV bar. You want slow, sensible, and covered? Cool. Grab a baguette and get in line behind Sven in France. It is like a magic trick. My insurance say, you are covered. But when you try to use it, they say, not that kind of covered. I go, I need help with my stress. My back hurt. I cannot sleep. Insurance say, we do not do mental, dental, vision, or feelings. I say, so what do you cover? They say, we cover paperwork and the bonus for your CEO.
Drop a comment below. Do you side more with Dudley, who is more for personal responsibility when it comes to healthcare? Or do you agree with June that healthcare should be a public right? Let's get a respectable debate going. I love you.